Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Drshelenalaljiesthetics, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Hello, everybody. Welcome back to my Get Well with Dr. Shel podcast today. I am with lovely Veronica Kent, who is the president and CEO of Alletess Medical Laboratories and an international leader in the field of food allergies, food sensitivities, and immunology tests, including mycotoxins, Candida overgrowth, and so much more. Alletess offers nutritional guidance, interpretive intelligence, and a clinical team that can work with patients and clinicians so that we can ensure better outcomes for our patients and give our patients health from their test results and give them ways forward to manage their health. Veronica has traveled the globe to ensure that Alletess offers the most up-to-date technology available in the allergy and sensitivity testing arena. And she has spoken at numerous conferences all over for medical professionals. She's also a member of the American Academy of Clinical Chemistry. I have had a personal experience with Alletess Laboratories for over 15 years and have used them and their wonderful technologies to help so many of our patients get better, feel better, and just have better lives. It's been remarkable to be able to have this testing available for our patients, and they've really, truly benefited from the test results. On a personal note, Veronica and I have also shared a very tough journey with both of us having loved ones with ALS. Veronica's brilliant father, who also founded Alletess Laboratories, was an ALS warrior just like my husband. We are both committed to care for and find a cure for the tens of thousands suffering with ALS in silence worldwide. Welcome, Veronica. I'm so excited to have you and to pick your brain. I think our listeners will really benefit from your insights on the many different topics we're planning to cover today. So good to have you.
Well, thank you for inviting me. I'm honored to be here with you.
Awesome. So first, before we dive into food sensitivities and Candida and everything else that we love talking about, I want to just touch base on what we do have in common personally, which is having a loved one with ALS. Veronica, your father passed away of ALS in 2017 when my husband was diagnosed with ALS. And I'm so, so sorry for your loss. I'm incredibly sympathetic for everything that you and your family have gone through. So when you're, currently battling ALS like we are, and you did with, your dad, I know that you worked side by side and so closely with your dad at Alletess. This just could not have been easy. Can you share a little bit about your journey with us and our listeners?
Sure. So my father founded the company in 1980. Mm-hmm. And when he retired, he started to have some neurodegenerative issues about 8 years ago. And he passed away on March 4th. So we like to call it March Forward Day here. I walk in every day. I have a laboratory museum outside my office where I think of him. And what I would do is, he was a patient at Mass General, and they had an interdisciplinary clinic, which is great. We go in once a month. So every month we try something new, be it something to, what I found is, which was really heart-wrenching to me, is I went over to his house one day, and people don't want to be a bother to their family. And ALS is a really tough journey for all involved. So he was actually cooking himself like a lean cuisine, because he could only use one hand to cook. And I was like, food is dignity, food is life. It's really such a great thing. So I actually brought in a chef so that he could pick out a menu and create his own meals every week, because I'm like, what are you eating, Dad? I mean, your whole life you've known.
Right.
But he didn't want to, So just trying to improve his quality of life and, nutritionally, as well as, with other testing.
Yes.
But it's difficult. It's
Absolutely. And I mean, he's lucky to have somebody that, really truly cared and tried to be a part of the solution, because you and I both know, and studies are being done, everywhere now about how important the gut microbiome is and what we put into our bodies. Truly food is our medicine, and medicine should be the food. And so we know that, you and I know that, because we're in similar fields. And when it comes to ALS and all other neurodegenerative diseases, Parkinson's, MS, dementia, Alzheimer's, any of those neurodegenerative diseases, in addition to cancers and, GI disturbances like Crohn's and ulcerative colitis or autoimmune conditions, we know that food is so important. And so isn't it so important to know what foods should be eaten by us individually? What is the best for us and our own system and our own antibodies and our own microbiome? So let's shift to food sensitivities for our interested listeners who are tuning in. Could you explain the difference between a food allergy and a food sensitivity?
Of course. So initially we just only did IgE food allergy testing, where you're looking at that acute allergic response. And what happened is people would come back and say, well, the test is wrong. And say, well, no, good news, you don't have a food allergy. But I'm not saying you're not having an adverse immune response to foods, but maybe it's not mediated by that allergic response. Right. So then we started looking at IgG foods. And the thought of IgG food testing is that you want to test, why we offer 96 or 184 food panels is we want to have enough negative foods to be able to provide a diet that is realistic for patients, that gives them multiple choices, right. Which is why we decided that when people get the results, of a 96 food panel and you have 20 positive foods and you realize you can't have gluten or you have to take, dairy out of your diet, it's very overwhelming. So then what we did is we brought on registered dietitians, and I say that because they're licensed, because they do take patient phone calls and Zoom calls in order to help people, because honestly, the test results at the beginning of the journey. It's what you do with a test result that really can change your health and improve your medical outcome.
Absolutely.
And we have a lot of parents of autistic kids, so that we're able to answer questions. They are available to, people when they're overwhelmed. And our advice or the party line at Alletess is we recommend that you get off of the foods for 3 months to heal the gut, reduce inflammation, and then start to introduce them one by one.
Right. I think that's a great point. And just to kind of, reemphasize what you're saying, food allergy, for those who are listening, is when you have more of an immediate reaction. So, you could have a peanut allergy, or you could have, a shrimp allergy, something that might trigger a response, which could, be hives or rashes or even difficulty breathing. And that is your IgE response. A food sensitivity is really important to test, because isn't it true that you just really don't have an immediate response? And most people don't know what their food sensitivity is, because your response could be anywhere from 24 to 36 hours later, and you're not going to know what triggered that response of your IgG. So, when we see patients, and, I do Alletess food sensitivity, and we'll get to Candida testing and some of the other testing in a bit, on just about everybody that I see, because I almost feel like once you take away the foods that you're sensitive to, it's almost a fog that lifts, because you're no longer inflamed chronically. And that inflammation that starts in the gut can easily go into neuroinflammation and give you brain fog and insomnia and fatigue, and sometimes depression and anxiety. What are some of the other symptoms that you see, that we've studied in people who have food sensitivities and they keep eating those same foods? What do you see in the patients?
So we see a lot of chronic conditions. We've found that we've heard feedback from clinicians who have patients who have autoimmune diseases, and they're having, say, a salad every day for lunch. It seems very healthy. They're eating healthy, But actually, nightshades, tomatoes, potatoes, eggplants, peppers will contribute to inflammation in the joints. So I had one clinician, he's actually an ENT instructor, and he said, I can't even believe this patient was so inflamed. And she said, well, I had the tomatoes every day in the salad. It showed up on her test. She took it out, and it really changed her quality of life.
Yeah.
Amazingly.
It's amazing.
And
it's similar story that happened to me when I first started practicing functional medicine. I did my own first food sensitivity testing. And just like you said, I was eating a salad every day and I thought, oh my gosh, I'm such a healthy eater. Why am I feeling so sluggish after I eat? And why am I feeling this brain fog? And I'm trying to see patients, not feeling good. And lo and behold, my food sensitivity showed that the spinach that I was eating on my salad every single day, I was sensitive to. And you would think, and this is how I tell patients in my practice, is it may be healthy, but it is not healthy for you right now. We need to eliminate it for 3 months, right? And go talk about that. Talk about the elimination program. And then the reintroduction.
So the elimination process is the most important. Obviously, we want people to be successful. Yeah. And I hear the dietitians, a lot of times the biggest advice they give people is people will think like, oh, well, I had, dairy today. Oh, well, forget it. No, it's dose related also. So it doesn't mean all of us aren't 100% every day on all of it. But once people do, initially the first 2 weeks are the most challenging. And then people realize, oh, I'm not tired every day. Just because I'm getting older and busy, it doesn't mean I have to be tired every day. It was the foods that I was eating.
Right.
And we have a lot of questions. So we provide a 2-page shopping list. It's our own database of 1,200 foods, because we like to flip the message and say, let's not focus on what you can't have, but look at all the foods you can have.
Correct. And in the clinical setting, I'll tell you, that is the most important page that I turn to when I'm counseling patients on their food sensitivities, because like you said, let's be positive about it. Let's not focus on, what you're sensitive to and what needs to be eliminated. Because if you look at that grocery list, and I tell my patients, copy these 2 sheets, keep it in your purse. And every time you go grocery shopping, pull it out, and that's what you're going to shop from. And it's plenty of foods. And you all have done a fantastic job of creating not only that shopping list, but you have a wonderful resources in the back. And you have wonderful natural treatments for things like your Candida overgrowth and Candida diet. And we'll get to that. But the kind of work that you've done, I have to really say and commend you guys. You've made it easy. You've made it easy for the patients. You've made it easy for the clinicians, because that goes a long way. Patients are going to be more compliant if it seems to be something easier to do. Food is tough.
And I appreciate that. Thank you. We work very hard here, and then when we reintroduce, we start with like the lower class one. We want people at the lower level class 1. So usually we have an idea that it might be the gluten or the dairy or the soy, but let's empower them, have, try, like say green beans, introduce, the lower level foods, and like, I can have this,
Right. Absolutely.
So when they get to the food that's so problematic, like I can do it.
Yeah. And, and I think just to clarify it for the listeners, when you do a food sensitivity test, you'll get sort of a number or a score. If it's 0, that means you're not sensitive to it. If it's 1, you're sort of mildly sensitive, 2, moderate, and then 3, severe. You want to keep those from being reintroduced until the very end, if at all, right? So if you are a 3 on, dairy or gluten or yeast or what have you, I tell my patients, these we know are inflammatory foods, and unless you absolutely cannot live without it, just keep those out of your diet, because our goal is to eat an anti-inflammatory diet. So I think that's really makes it doable for patients, because there's a whole list of foods that are very delicious that they can eat. So I think it makes it better. Yeah. So can you explain, let's talk about allergies. Can you explain what an a la carte allergy is to our listeners?
Sure. So we have recommended panels for different regions of the country. So say, where you live, you want to be tested for the trees you're exposed to every day, not trees that are in other states. But then we also have a la carte, where if people feel like there's a certain problematic food or, environmental allergens, that you can pick and choose from over 650 different allergens. And then we've also have panels of the most common allergic foods, because a lot of patients will say, well, I want to get 96 foods for food allergy and the food sensitivity, IgE and IgG. And as
Right.
much as we love testing, it's not necessary to test for 96, food allergies at one point. For food sensitivities, absolutely.
Yes.
But food allergies, 8 foods account for 90% of all food allergic responses. So we keep all the others on hand in case there's some unique food that a patient, like pineapple, actually my daughter has. So
Right.
that wouldn't necessarily be a common allergen, but we want to be able to catch based on patient history and symptoms.
Good point. A lot of people suffer from environmental allergies and food allergies. And I think what's important to really talk about is, first step is, if you're having some reactions, let's find out what the triggers are, whether the food allergies, so you want to do an IgE on all the foods that you can think of, that we're talking about 8 to 12 of them, and then the environmental. And I always say, for my patients, when I'm doing the environmental allergy testing, we live in Texas, and so let's test for what we have in this area. Once you know what those triggers are, what do you do next?
Oh, you have mountain cedar. That's a very potent allergen. So what happens is we will run the test, and then you can, based off of the test results, you can treat with sublingual drops or allergy shots. We usually advise clinicians that maybe you want to start by doing a food panel, the 96 food panel, to look at food sensitivities, and if they have environmental allergens, start there with treating just to reduce the load on the immune system and start to heal the gut. Yeah. We also see a lot of with food sensitivities and environmental allergens, cross-reactivity. So if you have a birch allergy to birch tree, it's the largest superprofilin family in nature. You're also going to have a sensitivity possibly to like the apple skin, pears, peaches, almonds. So you can stay away from some of those foods during birch season to reduce the load on your immune system.
Right. And the key here is, education, right? The key is we want to have our patients really gain health based on our research and based on our experience. However, it is also very important to realize medicine now should be very customized and personalized. And the only way for us to do this is we do need to know what your or each individual patient's food sensitivities are, food allergies are, environmental allergies are, if they're struggling, and if they feel like there's a load on their immune system. I mean, these are tests that I've done on my own children from when they were really young. All of us suffered with environmental allergies. And after doing the testing, we all did the sublingual drops, which are super convenient. So for those of the listeners that don't know about it, everybody's heard of allergy shots where you go into your, allergist's office once a week for an injection. That can tend to be a little inconvenient for a lot of people who are very busy. The immunotherapy drops are sublingual drops that are placed under your tongue, 3 drops a day, 3 times a day is the ideal. And over time, you're desensitizing. Do you want to talk a little bit about the research behind that, Veronica, about desensitization and allergies and how to get rid of it from a perspective of research?
Yes. So what's very interesting is in Europe, they've been doing sublingual drops for over 30 years, actually. In the United States, we use allergy shots, and the compliance level is fall off because you're supposed to go every week for the shots.
Right.
So the sublingual drops are basically just an off-label use of the allergy shots. It's the same allergenic extracts. They're just in glycerin as opposed to saline. Right. And what's interesting is I actually went to a class on this in La Crosse, Wisconsin, and the sublingual drops have less of a reaction. You might get an itchy throat or something, or tongue, but at the end of the day, as opposed to introducing allergen into your entire humoral system, you have selective immunity in your mouth. So the uptake into your immune system is through your dendritic cells. Right. So it's a much more passive and better way to enter into your body. And also, my boyfriend's been on the drops for about 3 years now. He was severely allergic. He plays golf. He shouldn't even be out when someone mows a lawn. And the difference it made in his symptoms, he was taking over-the-counter, antihistamines, which make you exhausted, sinus rinse, Flonase, all the time. I said, what is wrong with you? We've been together 10 years. And when he started the drops, the first year he didn't take any medications. The quality of life for seasonal allergies is amazing. Huge. And it usually by treating, some allergies, you'll spark enough of an immune response that you'll improve other allergies also.
Absolutely. And this is
really awesome.
Yeah. This is a big deal in, areas where allergies are a real problem. In Texas, I know I moved from Atlanta about 20 plus years ago. I never had allergies before I moved to Houston, and
Right.
voila, bam, lots and lots of just sneezing, sniffling, headaches, all of those, seasonal allergy symptoms. And those did go away completely after I did my sublingual drops. But also, another personal experience, my niece, very allergic to different nuts, to the point of, being anaphylactically allergic. And I want to kind of forewarn, if there are allergies like this, definitely make sure that whatever you're doing to desensitize, you're definitely doing it under a physician guidance, very, very closely monitoring and making sure.
Absolutely.
Very close monitoring, especially if you have anaphylactic reactions. And so she's been on the drops for the last 2 years, and she's heading off to college now, which was a huge concern for us. Doing so
Right.
much better. She just doesn't have the triggers as much as she used to. And it's just getting so much better, much more so than even we had anticipated. So there's a lot of great science out there. And I think, for our listeners to know about it, I think they can really take their health into their own hands and be their own advocates and know that they don't have to feel this way, because there is good science behind sensitivities and allergies. It's very important.
Right. And we do find a lot of patients are frustrated that they've been searching for some answer. And the beauty of the drops is when your niece goes to college, you can ship them there. So they're, they get refilled every 3 months, as long as your symptoms are monitored by your physician and you're doing well. It's
so convenient. And I mean, if you think about teenagers who want to take a shot every week, but they don't mind taking sublingual drops. It's very easy.
And once they see the improvement in their condition, they buy in.
Yeah.
Which is great news.
Awesome. True. Absolutely. So let's talk a little bit about, what kinds of patients, and I know what I do clinically, but I'd love to hear from you because, you provide testing to everybody all over the country, and you have so many different accounts and physicians. So for our listeners, who do you feel should be tested for food sensitivities and food allergies? What kinds of symptoms do they normally exhibit? And what are some of the most common sensitivities that you see in the lab when we're doing the testing?
Well, of course, we have patients who they don't feel well. They have headaches. They have eczema. Children who have learning disorders. People who they're not sleeping well at night. They don't feel well, but they don't know why, and they want some sort of answer. We find we'll have patients call that have been to many different physicians, but they feel they don't have an answer. Right. So a food sensitive, because a lot of times we're like, why can't there be a connection between what you eat and how you feel?
Right.
Sometimes we find, I have one of my best friends, her son was an elite athlete in high school, and he started having gastrointestinal issues. So he dropped off the lacrosse team. He didn't want to go out. Mm-hmm. And she's in Children's Hospital for a year, so frustrated having all these procedures. And I said, let's just do a food panel on him. And he was eating peanut butter on wheat, thinking that was safe and would make him feel better. And of course, the two things that blew up were gluten and peanut butter. And now he got off of those. It changed his entire life. I mean, people were willing to give him he's depressed, it must be something wrong, but he really wasn't. It's depressing when you don't know when you're going to have to run to the bathroom, right, when you're going out. We also have this interesting segment that's developed over the past 5 years of elite athletes. Uh-huh. So athletes who are about there and they want that final percentage. So like football players in the NFL who are running great, but they want to be a little faster. Tennis players. So it's interesting. We did some health and wellness for the PGA. So it was so that's a different segment than people that are sick, but that's interesting. They're both as compliant. Right. Because they both want to see improve. Absolutely. I think that, and from a basis of, having done this in functional medicine for the last 20 plus years, I think that, when I want to test my patients is because, if I sense that there is, well, first of all, the gut is the centermost organ to wellness and well-being and decreasing inflammation. And when you have food sensitivities,
the inflammation is constantly there in the gut, which then, you can have even things like if you have joint pain, if you have skin rashes, if you have acne, if you have rosacea, if you have eczema. When I have patients come in for skin issues, I always want to look at the root cause. And the first thing I look at is what foods are you eating and are you sensitive to those foods? When you have a skin issue or any other symptom, it's your body speaking to you. It's your body communicating with you that something is awry, something is wrong. I am getting exposed to things that I do not like, or I'm developing antibodies to. So I think the range of symptoms, like you said, is very wide. And if you want to have your best life, be the most optimized, be revitalized and rejuvenated and feel excellent, you need to really focus first on food and diet and gut.
Right. And then, of course, now think about 10 years ago, did you ever see all these commercials for like acid reflux disease? I mean, that's definitely contributes from your diet. There's no reason you don't get all these pills first. Let's look at what you're eating.
Exactly. No, I couldn't agree with you more. When I see patients and they come in and I mean, I say this so much when patients come in and on their medical history, it's IBS, IBS, IBS. And you and I know IBS is almost a trash can diagnosis for, okay, you have bloating, you have acid reflux, you have, inflammation, you have all of these things where you just can't explain what it is. And so you have IBS. And then, but we do know, and this just came out recently, that the age where colonoscopies were recommended was 50. They just recently announced that the age at which you should start having a colonoscopy is 45, because they're seeing a huge increase in the incidence of colon cancer, which you and I both know we have so much inflammation from our foods that we're eating and chemicals and pesticides, and they're not organic and they don't have the right ingredients. When you are exposed to all of that, it triggers an inflammatory process, which can be the basis for future cancers. Can we talk a little bit about that?
I actually had a colonoscopy when I was 44. I had 3 children. I just didn't feel well. And I actually had a growth that was practically occluding my entire colon.
Oh my gosh.
So I ended up having 3 colonoscopies in 1 year, but thank goodness I didn't ignore any symptoms, went right to the doctor.
Good for you. And I would definitely say that, the food that you eat is the trigger for a lot of the conditions that we're getting. So if you have GI issues like constipation or diarrhea or pain or reflux, definitely start with food sensitivities and food allergies and see what is triggering this. Try to focus on that. And then I always say, you want to remove the stimulus, which is the foods that you're sensitive to. Mm-hmm. Step 1. Step 2, you want to treat the inflammation that's already there. So I always say that, you need your digestive enzymes, you need your proteolytic enzymes, you need your probiotics, the right strains, and then you're treating that inflammation. You need to get on something similar to L-glutamine powder, which is going to treat gut dysbiosis and leaky gut syndrome. So it's not just about removing the stimuli, it's also about treating the inflammation that's already there. And the amazing thing is our patients, no more reflux, no more pain, no more constipation and diarrhea. It just, boom, gone in a few weeks. Isn't that something?
It's so amazing because you have the root cause and now they're not on, these prescriptions for years.
Right. Absolutely. So let's talk a little bit.
It's a game changer.
Yeah, you're right. It's a total game changer.
Oh no, that says it's a game changer.
Sorry, you just broke up, Veronica.
Oh. I'm okay.
Okay. All right. Let's talk a little bit about Candida. Candida overgrowth is something that we see in our field and in our patients all the time, much more so than you would think. When we talk about Candida and yeast, people automatically think vaginal yeast infections. Now, it is true that about 138 million women suffer from recurrent Candida or yeast vaginitis in the world, which is a humongous number of people, but that's not the only symptom we're looking for. So can you talk a little bit about what made your lab start doing Candida testing?
So we heard, it was the feedback from clinicians where they had, patients, a lot of patients, especially if they were positive to brewers and bakers yeast on the food sensitivity panel.
Right.
Then the physicians wanted to take like a deeper dive in and see what else is going on.
Right.
So we initially did a Candida, the immunoglobulin test, where we're looking at, so in our immune system, we have 5 antibodies. So IgM is our first responder to an immune response. Then we have IgA, it's mucosal, guarding your body entrances is how I see it. And it's your most made antibody because it's in your saliva, the lining of your intestines. And then we have IgG, which is more chronic, systemic. The half-life is about 28 days or longer. So we have IgE, which is allergy, and IgD, which is part of the immune response. So we look at IgM to see if you have a new infection that's just starting. We look at IgA to see if it's more mucosal, the lining of your esophagus. And then we also look at those antibody levels, which is the immune system is so fascinating, can go back into a normal value because now you're going to have this antigen antibody binding. So your antibodies are binding to the actual Candida and they form immune complexes, which is a more systemic stage where these are depositing in tissues in different areas of your body.
Right.
Then what we offer with that, yeah, because it's a yeast-free diet, you know, to get out of the sugars. There's a lot of fruits that are high sugar that people don't realize.
Right.
And different additives in foods that you don't really think, you wouldn't think are there.
Right. Right. Absolutely. Well, I'll tell you, the Candida testing that you all do is a game changer for so many of my patients. You know, just like you said, when I want to take a deeper dive, they don't always have to have the symptoms, if it's a female, of recurrent vaginal yeast infections. You could have symptoms of bloating, brain fog, fatigue, headaches, skin conditions, all kinds of conditions that really, you know, when I'm looking at their history and I'm talking to them and I'm really evaluating their symptomatology, which is why in the first visit, I like to spend 45 minutes to an hour with my patients, really assessing what is going on that could be triggering a lot of the symptoms that they're having. And when I find that they do have Candida overgrowth, and I love your test because of the 4 different levels that I get for my patients, and I really focus on, you know, what's going on with the different levels, and I can tell them if this has been a chronic condition, but yet you have an acute increase in your antigens right now, or if it has become more of a systemic infection. They love to hear that. They love to hear where the Candida is. Is it in the mucosal lining? Is it chronic? Is it acute? Is it systemic? And then what are we going to do about it? And I truly, truly love the kind of education that I can give to my patients, thanks to you guys and what you send. The Candida-free diet is a challenging program. You know, let's not joke with ourselves. I mean, it is challenging, but the benefit is huge. When a person has Candida overgrowth and they truly are compliant with the program for at least 3 months, and during the program, you know, and you suggest a lot of this at the end of your book, you have these great resources and natural remedies that you can do. Because again, it's a 2-step process, like we talked about with food sensitivity. You want to eliminate the source of Candida. So cut out all your sugars, cut out your processed foods, cut out the, you know, the hidden Candida and hidden sugars in your alcohol and other things. But yet you want to try to kill what's there as well, right? So apple cider vinegar, caprolax, oil of oregano, garlic, ginger, so many wonderful things. Can you talk a little bit about some of the natural treatments for Candida in addition to those?
So yes, we do recommend the vinegars and different things. Not sure what else I can think of off of the top of my head. We recommend, you know, just cleaning up your environment also to molds. You could be getting Candida exposure in other ways.
Yes.
That's, you know, causing systemic issues in your body.
Absolutely. So really it's just eliminating everything. And, you know, what's interesting is somebody who might come in and they are interested also in weight loss. When you go on a Candida-free diet and eliminate all your food sensitivity, the way that these patients lose weight, because it's all the toxic waste that is leaving your body. Right. So it is the healthiest way to lose weight is you get rid of all that junk, get rid of the Candida, get rid of the sensitivities, decrease the inflammation, and then the weight just kind of goes away. And it's incredible. People feel just great. They really do.
Well, what's so amazing about it is initially years ago, we used to call it like the Candida diet, because the word diet has these different connotations to it in our society.
Sure.
So then we changed it to the wellness plan, because people then call up, they aren't on it, they're on it for their health. It's not always necessarily like they're not doing it to lose weight, not that some of them aren't, but they call it, it's like an added benefit to have followed the diet. Not only do they feel better, so every January I offer, we have 45 employees at Alletess, so my employees can all order whatever test they want on themselves.
Right.
But the deal is you got to follow the wellness plan. And so we have our sales and marketing team is awesome. They did it. And then when a clinician says, well, have you done the test? Like, oh yes. And this is what happened. I lost.
Yeah. It's amazing.
Believe it. So we're preaching to the choir, because we all try it. It is amazing.
It truly is. It truly is. And I think what's really great is one of the other benefits that I see as a side benefit all the time is if somebody comes in with joint pain, it's incredible when they go on a Candida, wellness program and eliminate their food sensitivities. It's just crazy how their joint pain goes away, and it's crazy how they're sleeping better and their energy is better than it's ever been before. And there's no brain fog, and they're really feeling much better with their mental health, with depression and anxiety. It's just the effects are systemic. The effects are so widespread. The benefits are so widespread that you may not be doing it for that, but you tend to get all of these side benefits, which is great.
And it really empowers the patients when they can work with their clinician and then come back, and as opposed to coming in, I just want this prescription or whatever, just fix the problem. It is work, but the benefits definitely are amazing. And the health benefits, I mean, people's medical outcomes are just so much better.
Absolutely. I think it's also, before we shift away from Candida, I want to kind of talk about why there's so much Candida in our patients now, and just about everybody that we see. When we were growing up in the last 20, 40, 50 years, antibiotics has just taken over, right? So let's talk a little bit about that. Why is there so much Candida overgrowth in our population now, and in this country specifically?
And well, in young children, when you see a lot of antibiotic use, you do see gut issues. Most definitely, it has a negative effect on the microbiome.
Yes.
And a lot of times, as opposed to allowing some things to run their natural course, we treat them with antibiotics. Also, birth control pills and other things will contribute to Candida issues. So it's really just a major shift in gut flora, and the antibiotic use is a real problem where young children are having a lot of exposure because their gut flora is formed when they're born.
Exactly. And this is why even when I was practicing OBGYN, women taking the right digestive enzymes and probiotics even during pregnancy is extremely important.
100%.
And eliminating all the inflammatory foods, because everything is passed down to our babies. And, that's the best thing we can do. So I want to kind of switch gears to, both of us are really committed to neurodegenerative diseases and neurological conditions, and how that's so connected to the environment. And then when we see in our practices, patients with so many chronic conditions, one of the big things that we talk about in functional medicine is mycotoxins or mold, because we have now discovered that mold is really rampant, unfortunately, and so many people are exposed to it. Can you please address a little bit on the types of mold testing that you do at your lab and what got you very interested in mold and mycotoxins?
Right. Everybody talks about molds. I mean, there's thousands of molds in our environment. They're ubiquitous, but there are, about 100 molds that are harmful. And especially if people are already immune compromised in other ways, molds are, opportunistic.
Right.
So what we found for years is we did IgE testing. We have about 30 molds in house at the lab, or 35 that we have for the analyzers. And a lot of times physicians, so the head of an ENT department in Boston came to me and said, IgE molds are mostly negative. It's not always an allergic response. Okay. So then we started doing IgG molds. So IgG exposure. But then when was the exposure? Because IgG could stay elevated for quite a long time. So then about 3 years ago, we brought on IgA molds. So with IgA molds, what we're looking at is that more immediate response. Is it in the line, esophageal, in your mouth, like, so that would be within the last 6 days. So you're having some sort of current exposure to the mold.
Mhm.
And then I had done some research with our lab director looking at mycotoxin testing. And some of the research, a recent article in the Journal of Clinical Neurology,
Mhm.
said that they felt that serum testing for IgE and IgG molds was a more effective pathway, because if you're looking at mycotoxins, you might be having to do a current detox protocol to actually see a mycotoxin level in urines.
Mhm.
And so I feel like our IgA also helps with that. Like, it's more of a, like you say, more of a root cause. Like, let's see if the
Right.
mycotoxins are a byproduct of these, toxic molds. But if you have the mold, we can expect that down the road, you will get the produced mycotoxins in your body, which
Right.
will then start to attack your different cells and areas where the mycotoxins are depositing in the fats. They're not necessarily measurable in a serum test. So
Right.
we're really excited about that, because if you could know immediately that there was something going on with molds and with IgA, actually monitor it and see if it
Right.
was improving, that it's pretty, it's powerful for people. We see, like with ALS, they're finding that molds have an issue, autism,
Yes.
Alzheimer's, all these different diseases. We test for 5 autoimmune diseases just because we have analyzers with capacity: celiac, rheumatoid, connective tissue, thyroid. And we bundle it into like just an unexplained fatigue profile where people can't get the testing. So we're just trying to look at different avenues, but I find the molds are very fascinating to me.
Absolutely. And I think there's more and more research being done on it, thank goodness, because it's something that we really do need to look into, especially with my patients with, like you said, unexplained fatigue or neurological issues, or, Lyme disease and such,
Right.
autism, other neurodegenerative conditions. That is something that's definitely on my panel, and I definitely want to look and see what's going on with that. I think your lab is just doing a fantastic job. And, before we wrap up, I hope that all of our listeners will take this in and realize that gut health is at the center of your healing journey, whether it be your food sensitivities, food allergies, Candida, and now mycotoxins. If you're interested in any of the testing, whether you're in town or anywhere around the country, you can go to drshelmd.com to order a food sensitivity or Candida testing and learn more about it from drshel.com. Alletess Laboratory has amazing resources on their website as well. And, we're just, my patients and I are very grateful to you, Veronica, for all the great work that you and your dad and the entire team has done in this field of functional medicine. And so we can really provide so much better information and diagnostic abilities to our patients. Anything you want to add?
Well, I'm grateful to physicians like you who are, really take an active interest in getting to the root cause for their patients. I feel sometimes when some of our clients call, I love coming to work every day, and I'll say, let's talk to our clinical consultant. Let's look a little deeper. And they're like, wow, thank you for helping. I'm like, thank you for being such a great doctor. It's just refreshing. Your family, your patients are all very blessed to have you. Thank you.
Thank you.
And I'm fortunate to know.
Thank you. Great to have you on. All right, everybody, we'll see you next time. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.